Hello, everybody. My name is Jonathan Vita, and this is my project on Giardia. Okay, the pathogen for Giardia. Giardia is prevalent all around the world, but is commonly found in areas of poor sanitation and undrinkable water. This parasitic organism is the most common infection in the intestines in the United States. This parasite can survive uh, for a certain amount of time outside of the body, but it needs a host in order to survive long term. All right, transmission. This parasite is found commonly in animals and humans, but the types of parasites for human and animals are different. Humans have a lower chance of receiving Giardia from an animal. People are infected by Giardia through contamination in food or water from Giardia cysts, which is the hard shell that houses the parasite. Giardia needs a host to survive, but the cysts allow the parasite to survive without a host for extended periods of time. The most common type of transmission for this disease is untreated water and infected stool on the microscopic level. Anyone near the feces can receive this disease, and it tends to be common in campers and hikers. One other ways of transmission is no sanitation practices, being around young children, often because they're not clean, uh, touching surfaces with where the parasite was on, and then sexual interactions with a infected person with Giardia. All right, the symptoms. The most common symptoms are fatigue, diarrhea, upset stomach, nausea, bloating, and dehydration, which can cause weight loss. Normally, the symptoms last 3 weeks after exposure, and the sickness symptoms usually last a couple days after infection. And the digestive symptoms, they can last between 2 to 6 weeks. Some people show no symptoms at all. Giardia is not a lethal disease, but it can be dangerous to people with severe dehydration and pregnant women, and they can send those people to the hospital. All right, so diagnosis and treatment. The diagnosis for Giardia is mainly done through testing of stool samples, and usually multiple stool samples are needed to confirm the diagnosis. In some cases where the symptoms are severe, the person might have to have the doctor perform a upper endoscopy. It takes a tiny sample of the acquired intestine to confirm parasitic activity. Treatments for Giardia are usually not required, but more severe symptoms need medications that are prescribed to kill the parasite. If there are further complications, the patient would need to meet with an infectious disease specialist to create a drug combination to clear the intestines of this parasite. Okay, so the demographics and AI. The most common areas in the world where Giardia is are countries with no clean water, not enough toilets, and bad hygiene. The United States and Europe uh, are around 1 to 6% in infection rate of Giardia, while other countries like Africa, Asia, Cuba, and Mexico range around 8 to 30% infection rate. Some of the AI models that are used to help diagnose Giardia is uh, rapid screening of animals and people through microscopic tests, and they help diagnose the patient of Giardia and go through a process to help the doctor create a care plan for the patient. And these are my references, and that's it. Thank you for listening.